Welcome to CLIPS, the Conversations Leading to Insights on Policy and Science webinar series by the National Institute on Minority Health and Health Disparities. My name is Dr. Natasha Williams, the Legislative Liaison at the NIMHD. Today's webinar is on the NIH Precision Medicine Initiative. On January 20, 2015, President Obama announced in his State of the Union address the launching of the Precision Medicine Initiative. On January 30th, President Obama made additional remarks regarding the initiative.
I want the country that eliminated polio and mapped the human genome to lead a new era of medicine, one that delivers the right treatment at the right time. In some patients with cystic fibrosis, this approach has reversed a disease once thought unstoppable. So tonight I'm launching a new precision medicine initiative to bring us closer to curing diseases like cancer and diabetes, and to give all of us access to the personalized information we need to keep ourselves and our families healthier. We can do this. Because something called precision medicine, in some cases people call it personalized medicine, gives us one of the greatest opportunities for new medical breakthroughs that we have ever seen. Doctors have always recognized that every patient is unique. And doctors have always tried to tailor their treatments as best they can to individuals. You can match a blood transfusion to a blood type. That was an important discovery. What if matching a cancer cure to our genetic code was just as easy, just as standard? What if figuring out the right dose of medicine was as simple as taking our temperature? And that's the promise of precision medicine, delivering the right treatments at the right time, every time, to the right person. And for a small but growing number of patients, that future is already here.
Our guest speaker today is Dr. Regina Smith-James, who serves as the Acting Associate Director for Clinical Research and Data Management in the Office of the Director at NIMHD. She is also representing NIMHD for the NIH Precision Medicine Initiative and co-chair for the Community Engagement Health Disparities NIH Precision Medicine Initiative Working Group. Please visit the CLIPS website for her complete bio. Dr. James's talk today is on the NIH Precision Medicine Initiative. We will answer your submitted questions after her presentation. Thank you, Dr. James, for joining us today.
And thank you, Dr. Williams, and thank you for this opportunity to share information about the NIH Precision Medicine Initiative. Today, what I'd like to do is first provide an overview of the Precision Medicine Initiative in terms of the direction and the fact that the President has announced this initiative and its importance and significance, and then really go into some of the goals of the initiative, both short and long-term goals. And then we'll talk about the formation of the Advisory Committee, an important entity that actually provides feedback to the NIH Director, Dr. Francis Collins, around this initiative. And then we'll segue into the various workshops that was an opportunity to really bring in community perspectives from academia, pharma, advocacy groups, a number of constituents to really provide some information not only to the advisory committee, but also to the director about how we should proceed with this precision medicine initiative. So the Precision Medicine Initiative has a mission statement from the White House. And essentially it is to enable a new era of medicine through research, technology, and policies that empower patients, researchers, and providers to work together toward development of individualized treatment. So this concept of precision medicine, it's not a new concept. We've been involved in prevention and treatment strategies that take into account individual variability for a bit. And so it's not, and so for example, think about the blood typing. Blood typing is used to guide blood transfusion. That takes into account individual variability. When you think about going to the ophthalmologist, your visual acuity test, that is tailored to your individual needs. So this concept of individualized or precision medicine approach is not novel, but what I think is new is the advances in science that have come together that have really put us in a position to make very large leaps and advancements in our approach to prevention and treatment. So for example, we have more information about the human genome sequence, about proteomics, metabolomics, and genomics. We are also in a better position in terms of computational tools for analyzing large sets of data. And of course, the mobile health technology component has been very important. So aligning all of these variables together, we are now well poised to take into account individual differences to really dramatically improve prevention and treatment strategies. So let's look at a case study, for example, to really make this something that we can put our heads around. Let's take a 50-year-old male with diabetes who visits his doctor. He volunteers for a new national research network. Samples of his DNA and health information are sent to investigators for analysis. He agrees to track his glucose levels via a tiny implantable chip that sends wireless signals to his watch and the researcher's computer. The patient or the participant can also view his health data via a smartphone. So now, using all of this information, the doctor can adjust his diet and make adjustments to his medication. So this is how utilizing all of these new technologies and new information in metabolomics, proteomics, all of those areas of science have really propelled us to a place that we are now well poised to really take into consideration individualized tailored treatment. So healthcare providers will now be able to not only tailor treatment and prevention strategies, but they will also be able to take in unique characteristics, including genome sequence, microbiome composition, health history, lifestyle, and diet. So what are the goals of the Precision Medicine Initiative? Well, there are short-term goals as well as long-term goals. Now, the short-term goals are really focused around cancer. So, for example, to identify new cancer subtypes, to test therapies, to expand our understanding of therapeutic response as it relates to drug resistance, combination therapy, and predicting and monitoring tumor recurrence. Now, the longer-term goals are really around generating knowledge to move precision medicine into the whole range of health and disease. So, establishing the million-plus person cohort, creating new approaches for detecting, measuring, analyzing a wide variety of biomedical variables. So, for example, molecular, genomic, cellular, clinical, behavioral, physiologic, and environmental. Testing these approaches in small pilot studies, and then utilizing the most promising approaches in greater numbers of people over longer periods of time to generate new knowledge. So there have been a number of activities that have really provided an opportunity for feedback into how to move forward. It initially started off with the announcement by the President on January 20th and a subsequent meeting on the 30th in which he announced the Precision Medicine Initiative and its goals. Now, on February 11th, there was a meeting around how to build this cohort. How should we build a precision medicine cohort? And what I'd like to do now is highlight some of the suggestions or recommendations that came from workshop participants on how we should move forward on doing this and building this cohort. The first piece is that participants need to be partners in this research, including children in the cohort. This could be a valuable method to build a lifespan perspective on health and disease. Also, building a hybrid cohort That's incorporating some of the current NIH-funded existing cohorts and engaging new participants, thus building a hybrid cohort. The need to incorporate and plan for short-term and long-term goals for the cohort, and building flexibility. And that's forming this core cohort data set and then being able to layer tiers of participant groups and additional measurements on top of this base. And then rather than focus on any one disease, the cohort can provide a framework for researchers in a wide variety of disciplines. We should be able to also test the ability of mobile health technologies to both gather data from participants and also relay information back to them that could improve their health outcomes. And also utilizing blue button technology, this delivery of electronic health records directly to patients. This will enable individuals to download their own electronic health information and provides opportunities for them to share it with their researchers. So the first meeting, building the PMI cohort, really set the stage for how to move this initiative forward. So on the 26th of February, Dr. Francis Collins announced the formation of the working group. So on March 30th, the Precision Medicine Initiative Working Group of the Advisory Committee to the NIH Director was formed. And these individuals represented leaders in the field that can provide or that could provide NIH input, feedback, and direction about how to move this agenda forward. The charge of the working group was essentially to develop a plan for creating and managing a large research cohort. And the report that will be subsequently produced by this ACD working group should be delivered in September of 2015. Now, the investment in the Precision Medicine Initiative that's proposed for this fiscal year 2016, is as follows. So the National Institutes of Health should receive approximately $130 million to really develop this national research cohort of 1 million or more volunteers. The National Cancer Institute is anticipated to receive about $70 million, and this is really to scale up efforts to develop more effective approaches to cancer treatment. The Food and Drug Administration should receive about $10 million, which should be focused on supporting the regulatory structure that's needed to advance innovation and protect public health. And finally, the Office of National Coordination for Health Information Technology should receive about $5 million to develop standards that address privacy and enable secure exchange of data across systems. Again, keeping in mind all of these entities of the Department of Health and Human Services will be working collaboratively toward this effort, but each will have its own specific focus in moving this agenda forward. So now that the advisory committee to the director was formed in February, the following steps really involved a series of workshops that brought experts in the field together to discuss specific aspects of the Precision Medicine Initiative. So the first meeting that occurred on April 28th focused on unique scientific opportunities for a national cohort. And with this workshop, there was initially a request for information that went to the general public to really get feedback from individuals outside who were not going to be part of the meeting, but also to get more of a general feel from the community about what are some of the suggestions on reaching and taking advantage of unique scientific opportunities for a national cohort. So in addition to the workshop, the workshop coordinators also developed and released a request for information and received feedback. So this request for information actually received over 100, I think it was approximately 150 responses, but there were about 58 unique entities that responded in general. So most of the entities really revolved around healthcare systems, cohort studies or consortia, cancer registries, and individual products. And there was also representation from large healthcare networks as well as universities. So some of the highlights of the request for information around this NIH precision medicine cohort included the following. The respondents largely agreed with the proposed size of 1 million participants, although about 20% indicated that a cohort should be even larger than that. There was a strong emphasis on the cohort reflecting population diversity. And this is with regard to many characteristics, including age, ethnicity, socioeconomic status, and gender. It was also suggested that certain topics should be addressed, and these included drug and non-pharmacologic treatment responses, discovery of risk and protective factors for a broad range of diseases, most commonly more of the chronic diseases, and implementation of precision medicine findings in clinical care. In addition, respondents favored a long-term follow-up of at least 5 years, but more than 5 years actually was the common response, but at the very least 5 years. We should leverage existing studies and infrastructure, complemented by novel recruitment. It's important to have standardized collection of a core data set. And they also provided ideas for research questions and study design, including allowing participants to have access to their own data if desired. So following the request for information, the workshop occurred, and here are some of the highlights from the workshop. First, it was suggested that collecting a wide variety of environmental data, including environmental samples, geographical information, and socio-behavioral data was important. The cohort should also collect data across a wide time frame by including developmental data and multi-generational data. We should consider incorporating mobile health technologies in the cohort. We should also consider merging and analyzing biological and environmental data that may influence an individual's health. We should engage participants at the individual, family, and community level, and that would be an important way to encourage cohort participation. We should maximize cohort diversity, and this will allow researchers to more easily identify associations between biological, environmental, and socio-behavioral health factors and the development of the disease and the development of disease. There's also a need to train a workforce that is capable of analyzing, interpreting, and applying research results to the field of precision medicine. The next meeting that followed was on the 28th of May. It focused on digital health data in a million-person precision medicine initiative cohort. And some of the workshop highlights included the suggestion that the PMI should specify key research questions to guide the effort. This initiative should also seriously consider including children. We should ensure inclusion, and this is important. And special approaches and messages should be developed to recruit and retain underserved populations. And that an international collaboration could actually increase the value of the Precision Medicine Initiative. This initiative should take advantage of lessons learned in other projects, and again, should consider a hybrid model that is gathering core elements on participants recruited by different mechanisms, and then identifying key subgroups for more in-depth analysis of phenotyping and data collection. Building trust and developing policies that facilitate data sharing at multiple levels are two important components that need to be considered. On July 1st, the Participant Engagement and Health Equity Workshop was hosted. This workshop was preceded by a request for information as well, followed by the workshop. So the request for information for the Participant Engagement Health Equity Workshop really came down to two common themes. The first was around community engagement strategies, and the second was around leveraging the research to address health disparities. Of note, this request for information received 69 responses, including 2 international responses. So in reference to community engagement strategies, these are some of the quotes directly from individuals who provided feedback into the request for information. So in reference to engagement, the respondents noted that meaningful involvement of community members from a very early stage in development of aims, procedures, analyses, and communication of results is important. In reference to communication, the major component of reassurance of the positive benefits of this will be constant communication, and that includes listening, education, and dialogue involving people who are respected and trusted by the community. Transparency is important. This project must operate with the highest level of transparency possible, including frequent project updates to key stakeholders. And in terms of partnerships, we should build not only national, but local community action boards who will partner equitably with researchers. Now, around the common theme of utilizing the research to address health disparities, there were 4 thematic areas that rose to the top. The first was around multidisciplinary studies. Respondents felt that we should study the multiple determinants of health and their interactions, such as personal, social, economic, environmental factors, on disease risk, disease mechanism, and individual response to therapy. It will be critical to include careful, valid, and robust measures of social factors across the life course, including socioeconomic, psychosocial, and environmental conditions. We need to address what are the genetic and environmental factors across the lifespan that influence the development of disparities in risk and incidence or progression of hypertension, chronic kidney disease, and other chronic diseases. And finally, what new health literacy approaches will be necessary to ensure that patients and families understand precision medicine? And will these vary within subpopulations? So those are some of the salient highlights from the request for information. What followed subsequently was the workshop, and I'd like to share a few of those highlights with you as well. The first is around governance. Governance should include participants, and participant preferences should be given equal weight for decisions about research priorities, data sharing, and return of results. We should ensure that the cohort is designed to understand and address health disparities. And we need to define diversity holistically to include race, ethnicity, LGBTQI, all ages, people with disabilities, pre-existing conditions, comorbidities, socioeconomic status, education level, geography, a whole host of variables should be considered when defining diversity. In addition, there should be meaningful relationships, transparency, and trust. These are essential components in building a precision medicine initiative cohort. People are enthusiastic about the goals of the initiative, and many people may be more willing to share data than researchers or institutions might expect. Researchers should engage with participants and communities to convey the purpose of the research and how contributed data will be used so that participants can appreciate the value of the research. Federal and state agencies should continue to work together to ensure that policies that address data sharing and data access provide robust protection for participants while enabling data sharing. The last meeting occurred on July 27, and this meeting focused on mobile and personal technologies in precision medicine. 3 of the key points that came from this workshop included the following. We need to be able to take experience from smaller cohorts that employed mobile technology and scale up for a larger cohort. We will need to develop apps that can facilitate participant engagement and retention of participants. And finally, careful consideration must be given to balance the following: bias versus diversity, privacy versus security, feasibility and validity, and finally, data management and integration. So I'd like to thank you for taking the time to listen to the summary of the NIH Precision Medicine Initiative. Thanks for the opportunity to share the information.
Well, thank you, Dr. James. We have received a few questions from our audience. Question number 1, what is the role of NIMHD in this initiative?
Well, that's a wonderful question. Thank you very much. The NIMHD actually is playing a leading role in this initiative. The Institute actually came out very early, relatively speaking, with a funding opportunity announcement to engage and provide data around precision medicine. It's called the NIMHD Transdisciplinary Collaborative Centers Funding Opportunity Announcement, and it's a U54 mechanism. The scientific point of contact for this funding opportunity announcement is Dr. Nishadi Rajapaksa, and the applications, I believe, are due September 17th. And they're really going to focus on 4 priority research areas: data integration, population differences in pharmaceutical therapies, I believe, translating pharmacogenomic discoveries to health, and implementation research. And it's my understanding that NIMHD intends to fund at least 3 awards. I think the investment is around $6 million. And there was a lot of interest in this funding opportunity announcement. I understand from the program officer that there was a pre-application technical assistance in which there were a number of potential grantees who were interested. So I'm sure that this will receive a number of applications. And again, NIMHD was in the front, really putting this funding opportunity out on the street, and should really receive some nice meritorious applications.
Okay. Our next question is, what are the next steps?
Well, there are a number of next steps. I think the first most important next step is really around receiving the recommendations from the advisory committee to the director so that we know how to specifically proceed. But before that happens, there are a number of things that actually occurred during the time of the workshops, and I'd just like to share those. The first one was the White House Champions of Change for Precision Medicine. This was actually, of course, sponsored by the White House, And it was really an opportunity to nominate individuals or organizations that are leading the way in health research and discovery. So for example, someone who was a researcher who's using a data-driven approach to improve treatments could be nominated. Leaders who are empowering people to work together to share their data, or individuals who are developing innovative tools to analyze data sets. Advocates who are working to ensure that patients are handled in a way that ensures privacy and security is utmost and important, and patients who benefited from precision medicine approach. So a number of these individuals were actually nominated, and I think there were about 10 who actually were chosen to be champions of change for precision medicine, and they were invited to the White House, and there was a reception, and they had an opportunity to share their various approaches to precision medicine. So that was one event that occurred. There's another event that's actually coming up on September 3rd. Again, it's sponsored by the White House in partnership with NIH. The Community Engagement Health Equity Working Group, of which I am a co-chair, actually solicited nominations or recommendations for individuals who are involved in grassroots organizations and provided these names to the White House. So as the co-chair, myself as well as my other co-chair, Dr. Vince Bonham, as well as the members of the team, really were knocking on the door and asking many of our colleagues here at NIH, can you please provide us names of individuals and organizations, at the grassroots level that could really benefit from hearing information about the Precision Medicine Initiative. And so we provided that information to the White House. And so, again, on September 3rd, they will be inviting and hosting a group of folks in Washington, D.C. To really share this information, disseminate this information at the grassroots level. And then from, I think, an NIH standpoint, again, I mentioned earlier, we're all awaiting for the recommendations to be released. And once those recommendations are released, there'll be a number of meetings to develop NIH-wide funding opportunities. So we're planning to have a planning meeting this week, which is around September 4th, and then we'll have a what we're calling an all-day retreat or writing sessions in which we will be writing and developing the funding opportunities around this initiative. So those are some of the up-and-coming events around this very important initiative.
Well, Dr. James, I want to thank you for joining us today and for your presentation. We would also like to thank the CLIPS production team, Mr. Edgar Dews and Mr. Aaron Friedel. And for those who joined us on the webinar, we look forward to you joining us for future CLIPS webinars. Thank you.
Thank you for the invitation.